Hi, Don here. Welcome to Podiatry Practice Mastery. I'm going to go over the $1 Million Minute. These are the things that help get my practice to the $1 Million mark and beyond. Recently, I guess the MVP patient there were two patients of the day that were MVPs. The first one was a patient that came in, had a kind of bulbous change to the Achilles tendon. And I've realized that really the best offer that I have is not so much there's like this saying out there, you can either do three things. You can either do speed, you can do quality, or you can do price, but you can't do all three. And so I tend to focus more on speed and quality, and I don't worry about the price aspect. I think a lot of times in the past I've worried about price, but now I do try to speed and quality. So for example, this patient came in and I went over the typical thing. Okay, you could try like icing anti-inflammatories, but really, does that help this? Not usually that much. You could try 6 weeks of PT twice a week, but if you really want what works, we can speed it up using Shockwave, and it's about the quality, 82 to 85% effective, and they did opt for the Shockwave route. So this is kind of the conversation that I'm having more with patients now. If they want speed and if they want quality, meaning they want to get better faster and something that is research-backed, that's where I think the Shockwave works for them. And so this was a MVP patient that got the 6 sessions of Shockwave, and then I also kind of prepare them to help the mechanics. Usually at the third visit is where I do the orthotic. So I'm trying to get better at the orthotic thing, adding that in to the whole kind of package. And I'm using my treatment sheets. A few people have reached out to me for my treatment sheets. If you want to see how I do them, just shoot me an email down at podiatrypracticemastery.com. I will send it. I just basically put the sheet on a clipboard, go through it, say we're going to do this, this, and this, and they say yes, and then we do it. So that worked well. I'm going to go over, this is a recording for a Thursday. Actually, I think it has 2 days together, so let's start here. First one's a 40-year-old male that was a new patient, and he skipped the other treatments, and he went directly to the fungal kit and the Lamisil. And he also was a self-pay patient, so he was a barber in town, and he just wanted treatment quick. So actually one thing that we're working on right now is we put an urgent care webpage and doing blog posts to push towards that urgent care, because I think, once again, the focus is on quick and quality, not so much on price. Okay, and so we're getting people because of that. He was fine paying for everything because he was going to get in here quick, whereas most people have a long wait. Next was a 38-year-old female, status post first MPJ injection. She's doing better. We did an orthotic, and she's going to follow up in the future after the orthotics get back. Next was a status post fibular fracture. She's having some reduced range of motion, so she's going to get PT right now. She's feeling better. I'm going to see her back in 2 months. This was the first follow-up after her fibular fracture. Next patient was an 18-year-old male with left lateral hallux. I did an IND, no follow-up. Next was a 72-year-old female. She did onifix. This is her third session, and so I kind of did the office visit onifix. I'm struggling with both onifix and Keryflex because they're not really largest checks, and they work a little bit better if I do an office visit, but for some of them, it's hard. Like the next one was a 31-year-old. She did Keryflex, and it fell off, and so I had to see her. I did the Keryflex no charge, just did an office visit. But those things, I would love if I could push those more to Marjorie, my nail tech, to do those. Next was a left fourth met base pain, 35-year-old male. So we did a cam boot for him. He was just trying to give it time, and if it's not getting better, we're going to do a CT. Next was a 51-year-old male for left IND. Next was a 78-year-old, had second digit dislocation. So I talked to her about, she's like an older patient with this dislocation. It's been dislocated for a while, and really the best option is going to be to amputate versus relocating. But it's not really bothering that much, so we're not going to do anything. And then next patient was this was a kind of a challenging one. He's a 55-year-old gentleman that injured his sesamoid at a work-related injury, and now we have to get like workers' comp involved, and these just kind of drain my energy. I do not do a lot of workers' comp, and getting things reset up is kind of a challenge. Okay, that was, I think that was my Tuesday half day, and then I went to Strategic Coach on Wednesday. So I'll do another podcast about my Strategic Coach experience. It was a great experience. Really, the best takeaway is I found this new ChatGPT Alex Hormozi kind of, I don't know, it's a channel or something like that. And I do have paid ChatGPT, and it really helps me with a lot of my marketing ideas that I'm working on. That was one of the main takeaways. So then Thursday, 61-year-old male, number 2 out of 6 for Shockwave for his bulbous bulbous Achilles. Next was a 72-year-old status post bunionectomy, doing better, no follow-up for him. Next was a 50-year-old female, number 1 out of 6 for Shockwave for plantar fasciitis. Next was a 57-year-old follow-up for orthotics, doing well. They're going to come back as needed. Now, one thing I was originally taught was every orthotic patient needs to come back in 1 year. And I think there's some truth to that, but the challenge is if you're trying to optimize for profitability and largest check, like a lot of these just regular orthotic follow-ups in a year really aren't really great profitable patients for me, because it might be a level 3 office visit, but that's about it. There's nothing else. So I'm trying to work around this, but I'm not seeing them back in a year. I'm seeing them back as needed. I'd like to hear if anyone else is doing this. So this might be more for like a really busy practice that has a lot of high-value patients. So if you're not as busy, maybe having them come back in a year. Another thing I thought about is maybe having them come back in a year, but use like a 10-minute slot to not do that, to not like occupy other slots. I'd like to know what other people think of that. Next was a 61-year-old female, diabetic exam, set up ABIs, did nail care. I'm going to see them back on one of my Fridays. Now, I am back. Now, I'm 3 months deep into this ModMed transition, so now I feel like I have some breathing room to start doing diabetic foot exams and ordering my ABIs for these patients. I kind of took a hiatus of that, only because it was really hard to track. And just a reminder, the way I kind of do it is everyone diabetic over the age of 50, everyone non-diabetic over the age of 70 gets an ABI once a year, and diabetic foot exam usually the month before or month after their birthday. Okay, like the month of the birthday, before and after. That's how I kind of track them in my system. And I'm not doing it usually for diabetes as a diagnosis. I'm usually doing it for one other condition that they have. Next was a patient, 42-year-old female. I set up EPAT 3. The reason I did 3 is basically she had plantar fascia in the past where she did 6 EPATs. Or she did 3 last time in her plantar fascia, and that was before I switched to 6, so that's why she's only doing 3. And I'm going to do the posterior tibial tendon. I did an ultrasound as well, showed her the effusion around the tendon and kind of the tendinous fibers, and so she's going to do that. Next was a 71-year-old male. We had fifth met calluses. I did dispense Dr. Jill's, like these callus pads in the pumice. Did the callus. He's aware, probably not covered. Next was an 85-year-old set up Shockwaves 5 and 6. This is for midfoot arthritis at an 87-year-old that really doesn't want to do surgery. So that's kind of a challenging one. She already has an AFO from hanger. That didn't really help her that much. She's struggling with this, and she might just have to kind of live with this pain if she doesn't want the surgery for the midfoot fusion. Next was a 16-year-old for a right ankle sprain. Has ankle pain, dispensed an ankle brace, and physical therapy for this patient. Next patient was a 57-year-old female for left plantar fasciitis. They got my Pelto Special, which is a night splint foam rolling and morning stretch, and then they also got orthotics as well. Actually, that 16-year-old. Actually, there's another kid as well that got a pair of orthotics. I think it was the ankle sprain kid. He wanted a new pair of orthotics, so I scanned him for orthotics, and then one other patient that had shin splints that got orthotics. So my goal for the day, most days, is to do 2 orthotics per day, so I did meet my goal this day. Next was a 51-year-old with ankle sprain, Blue Cross Blue Shield, so I had to have them send out for an ankle brace. I couldn't give it to them, so I sent them to Amazon, unfortunately. I'd like to know what other people do. If they, do you have like a self-pay price for the brace? Maybe you can do that versus billing insurance. I'd like to know if other people do that. Like, that would make sense. Like, if we don't want to bill their insurance because we can't take it, could we just have them buy the brace at a cash pay price? Next was a 44-year-old female with an onycholytic ingrown toenail. I trimmed it back. That was a real simple one. Next was a ingrown where I did a matrix. Actually, it was a matrix follow-up. Next was a peroneal tendon that is subluxation. I did an ultrasound and a tall cam boot, and if it's not getting better, I'll do an MRI and possible shockwave. Next was that Achilles I talked about, and it was number 1 of 6. And then next was a plantar fasciitis, number 1 of 6. This is a gentleman, he's a psychiatrist in our building, and so I'm going to be doing this for him. Next was an Achilles, and they wanted speed as well, so I did numbers. I did set up 6 shockwaves. That's the one I kind of told you about before, and then the last one was a shin splint patient that got orthotics. They kind of came in asking for orthotics. So that was the day. Once again, I'm putting together a challenge, I'm going to call it. I'm going to limit it to 15 practices, I think, or doctors, and this is going to be a challenge to kind of bring your practice up to the $1 million mark. So it's for people that are probably under the $1 million mark, so probably 400, 500, 600,000, maybe 700,000, but you want to get past the $1 million mark. We're going to do a 6-month challenge with kind of like a mastermind. If you're interested, you can go to podiatrypracticemastery.com/challenge, and that page should be up soon. Okay, talk to you tomorrow.